Morning, everyone. We'll get started here shortly, just making a little more time to get everyone admitted before we get started. Just a few more seconds here and we'll get started. Okay. Well, good morning, everyone, and thank you for joining us today. My name is Rebecca Syme. I'm a registered nurse with a diverse background in healthcare. I'm also civic certified in infection prevention in the long-term care setting. I serve as the team lead for South Dakota Project Firstline, and I am happy to be here with all of you today. Our office hours are held on the second Wednesday of every month at 11 o'clock. There's a safe place for like-minded infection preventionists to meet, discuss, and share knowledge. Feel free to chime in if you have any questions or would like to add any insight to today's presentation. This really is for all of us. Feel free to tell your friends and colleagues that they too can join us on office hours by navigating to our website, stprojectfirstline.org, and use the link to register for office hours. You can also find the registration for the newsletter there. And I think Jess is going to help out today and drop some of those items in chat as we go along, so you can look for them there. Another thing to bring up is Infection Prevention Week is October 13th through 19th. South Dakota Project Firstline has some fun interactive learning opportunities available for you to use. They are on our website, but Jess will also drop the links for those into the chat. So feel free to check them out and put them to work. They are a couple of things that are easy to use. Make sure that you're muted when you come on the presentation, please. So just a reminder to everyone to mute your mics. Okay, let's see. As a reminder, also, the 2024 APIC South Dakota Conference is being held October 3rd through 4th in Sioux Falls. APIC South Dakota is bringing some speakers together from across the nation, including the CDC, the Joint Commission, Civic, and others, many great speakers. So Jess will drop into chat the link for registering for the conference. We hope to see you all there. It is a great opportunity. It's going to be a great conference. With that, I would like to personally welcome you to South Dakota Project Firstline's monthly office hours for September. That was a lot. All right. So the CDC launched Project Firstline nationally in October 2020 to address longstanding gaps in infection control practices and to get IP knowledge to frontline healthcare workers. Since then, it has evolved really to serve all members of healthcare. As far as the South Dakota Project Firstline team, aside from being busy providing training and education to hospitals and long-term care centers, assisted livings, congregate livings, we also provide education and training to nurses, dental and community health workers, students, as well as dental hygienists. And we'll do another little plug. If you're looking for any education, we're a great source. Our resources on our website, contact us personally. So let's see, the South Dakota Department of Health has contracted with us, the South Dakota Project Firstline team that works through the South Dakota Foundation for Medical Care to bring you Project Firstline in South Dakota. This project is sponsored by the South Dakota Department of Health's HAI-AR program. Project Firstline offers easy-to-use, accurate, and free infection control training resources. The team has prepared another fantastic presentation for you today, so let's go ahead and get started. Like I said earlier, if you have any questions, feel free to raise your hand, come off mute, chime in and add anything to the conversation. Your interaction and feedback is very valuable to the team, and this is a safe place for sharing. I already introduced myself. I know that we have Renee and Jess both as team members on the call, and I'll give them an opportunity to chime in and introduce themselves at this time.
Hello, everyone. I am Jess Stanko. I am a program director at the South Dakota Foundation for Medical Care and assist with South Dakota Project Firstline initiatives, as well as with the GP Quinn quality improvement work.
Renee, you're on mute, ma'am.
Damn. Sorry about that. Renee Robbins, registered respiratory therapist, program manager for South Dakota Foundation for Medical Care, and a team member of Project Firstline. And I do work in other projects within the organization as well.
Perfect. Thank you. All right, reminders for the presentation. Please feel free to submit any questions or comments. We encourage you to share comments, resources, links, and idea. That's what brings us all together, is that community of sharing and knowledge. The recording will be shared after the event, so look for that. We send it out to you in a couple ways and post it on our website. So another reminder to please complete the survey at the end of the event. Your guys' feedback is so very important to us. And if there are ideas that you have for future sessions or future topics or expansions, by all means, we'd love to hear that. And we would love to work on completing some of those for you. So, all right. And with that, today's topic is respiratory, and I am going to let Renee take it from here.
Okay, so today we're going to discuss respiratory, the review of the respiratory system, pathways for germs to spread, and what steps we should take to prevent the spread of respiratory viruses. When we're completed with this review, we're going to discuss influenza as well, because it is near respiratory virus season at this time. Next slide. So when we talk about the respiratory system, it includes the nose, mouth, throat, windpipe, and lungs. So when an infected person talks, breathes, sneezes, or coughs, they can produce respiratory droplets that could spread germs. Germs are more likely to spread in places with poor ventilation or lots of people. And when people touch their faces, those germs on their hands can end up in their eyes, nose, or mouth and cause an infection. When we think about the healthcare setting, there are a lot of tasks involved that can spread respiratory droplets. That can include aerosol generating procedures, intubation and extubation, or you can be doing activities with those close interaction and enclosed spaces, talking or examining a patient. And what can we do to prevent this? We can take control actions to reduce the risk, such as talking or examining a patient. Such as personal protective equipment, source control, maintaining good ventilation, hand hygiene, cleaning and disinfection of shared equipment. CDC does offer infographics for respiratory system profile that can be downloaded and printed and shared in your facility. Next slide. The CDC also provides short adaptable microlearn training sessions that can be used to educate your team on a variety of infection control topics. This microlearn covers cough and congestion, The microlearns are a series of guided discussions that connect infection control concepts to immediate practical value so healthcare workers can recognize infection risks and take action to stop the spread of germs. So pathways, as we discussed earlier, breathing in the germs and respiratory droplets. It can also include splashes and sprays that get into your eyes, nose, or mouth, and then touch germs in the nose and mouth, which can spread to your skin and hands. Next slide.
I'm going to chime in here for just a second. These microlearns are things we've covered on office hours in the past. They're great for you to plug and play with your staff and utilize them as kind of a pre-collection of education materials. And I do want to say that we have been told by the CDC that there is a water one in the works. And as soon as we see that, we'll be sure to get it shared out with all of you.
So other infection control practices that we can use is masks and respirators to decrease the spread of respiratory viruses during a respiratory season. Well-fitting face masks or respirators covering a person's mouth and nose can prevent the spread of germs when people are breathing, talking, sneezing, or coughing. Project Firstline signs are available to help facilities encourage masking. And if a facility doesn't require masking, they should still allow individuals to use a mask or respirator if they choose. Also, another important part of infection control and prevention with respiratory viruses is getting vaccinated. Vaccines remain the best way to reduce your patient's risk of getting sick and can help stop the spread of virus to others. If your patients do get flu or COVID, vaccines can make the illness shorter and less severe and reduce the amount of time spent away from work to recover and help avoid hospitalization. Now, we want to remember healthcare providers are the most trusted source of health information for patients. The CDC does have resources to help you talk with your patients about their risks for severe illness so they can take the right steps to keep themselves and their families safe. Next slide. So another infection control action is practicing respiratory hygiene and cough etiquette. When you practice respiratory hygiene and cough etiquette, encourage others to do so. It helps prevent the spread of infection. You can provide masks, tissues, and no-touch receptacles for tissue disposal at facility entrances, triage areas, and waiting rooms. Another important thing that we must always remember is the most important way to stop the spread of infection is hand washing. Hands are the primary way germs spread in healthcare settings, and cleaning your hands regularly with an alcohol-based hand sanitizer or soap and water is a simple yet effective tool to stop the spread of germs. We also want to clean and disinfect regularly. Environmental cleaning is necessary. And lobby areas, cafeterias, waiting rooms are all high-traffic spaces where germs can spread. It's also important to disinfect reusable devices and not reuse disposable items. Also, you want to check the air handling in your facility and make sure it's functioning as it should. Make sure nothing is blocking air vents and consult with your healthcare facilities management to ensure the heating, ventilation, and air conditioning or HVAC system is working efficiently for good ventilation. Next slide. So now we're going to jump in and talk about influenza. We're going to identify symptoms. How do you diagnose influenza and what's good for treatment and prevention? Next slide. Influenza is a contagious respiratory illness caused by influenza virus that infects the nose, throat, and lungs. Next slide. There are 4 types of influenza viruses, A, B, C, and D. Influenza A and B viruses cause seasonal epidemics of disease in people almost every winter in the United States. Influenza A viruses are the only influenza virus known to cause flu pandemics. Pandemics can occur when a new and different influenza virus emerges that infects people and has the ability to spread efficiently among people and against which have little or no immunity. So flu can spread from person to person. Most experts think that flu viruses spread mainly by droplets made when people with flu cough, sneeze, or talk. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Physical distancing between yourself and others can help lower the risk of spreading a respiratory virus. And then you can also spread flu by touching a surface or an object that has flu virus on it and then touching your mouth, nose, or eyes, but that doesn't happen as often as transmission through the air. So some of the common flu symptoms you might see are fever, cough, sore throat, runny or stuffy nose, muscle or body aches, headache, fatigue, and you may experience vomiting and diarrhea. Flu viruses can be detected in most infected persons beginning 1 day before symptoms develop and up to 5 to 7 days after becoming sick. People with flu are most contagious during the first 3 days of their illness. Some people, including young children and people with weakened immune systems, may be contagious for longer periods of time. Next slide. So you can have a cold and you can have influenza, and we've all probably experienced both, but there are differences in each respiratory illness. So with cold, you'll have gradual onset of symptoms. Influenza can be more abrupt. Fever is rare with a cold. Influenza, it can last 3 to 4 days and is quite common. Body aches are slight. Influenza with a cold and with influenza that are common and often severe. You can get chills with influenza. It's not as common in the cold. You can experience fatigue and weakness with influenza, not as often with the cold. Chest discomfort and cough is mild to moderate, and it can be severe with influenza. Stuffy nose is more common with a cold and not as common in influenza. Sore throat is more common with a cold, not as common with influenza. And then headaches are more common with influenza and more rare with colds. Next slide. Then we have flu and COVID-19, and they can have varying degrees of symptoms ranging from no symptoms to severe symptoms, but they share a lot of common symptoms. Fever, cough, shortness of breath, fatigue, sore throat, not as common with flu, but still can be shared. Runny or stuffy nose, muscle pain, body aches, headache, vomiting, diarrhea, change in loss or taste of smell. This is more common with COVID-19, as we all know. But they're both contagious respiratory illnesses, and they are caused by different viruses. Sometimes you can't tell the difference between flu and COVID-19 because they are so similar, so specific testing is needed to tell what the illness is and to confirm a diagnosis. Having a medical professional administer a specific test that detects both flu and COVID-19 can allow you to get a diagnosis and treated for the specific virus you have more quickly. So some similarities for COVID and flu is 1 or more days can pass from when a person becomes infected to when they start to experience symptoms or illness. It is possible to be infected with the virus that causes COVID-19 without experiencing any symptoms, and it is also possible to be infected with influenza without having symptoms. So the differences with these two respiratory illnesses is if a person has COVID-19, it could take them longer from the time of infection to experience symptoms than if they have the flu. Typically, a person may experience symptoms anywhere from 1 to 4 days after infection with the flu, And with COVID-19, it can be 2 to 5 days and up to 14 days after infection before you can experience symptoms. Next slide. So there are high risks for flu complications, and that's adults 65 and older, children younger than 2, asthmatics, neurologic and neurodevelopment conditions, blood disorders, chronic lung disease, endocrine disorders such as diabetes and heart disease, kidney disease, liver disorders, metabolic disorders, and people with a BMI greater than 40 kilograms or higher. People with weakened immune systems are also at risk. Other people can include pregnant people, people who live in nursing homes, people from certain racial and ethnicity minority groups are at increased risk for hospitalization, which includes non-Hispanic Black persons, Hispanic or Latino, and American Indian or Alaska Native persons. Next slide. So with children, there are emergency warning signs you should be familiar with: fast breathing or troubled breathing, bluish lips or face, ribs pulling in with each breath, chest pain, severe muscle pain, dehydration if they're not alert, seizures, fever above 104 degrees, any fever in a child that's under 12 weeks old, fever or cough that improves but then returns or worsens, and worsening of chronic medical conditions. Next slide. Adults also have complications that you want to pay attention to: difficulty breathing, persistent pain or pressure in the chest or abdomen, persistent dizziness, confusion, inability to arouse, seizures, no urination, severe muscle pain, severe weakness, fever or cough that improves but then returns or worsens, and again, a worsening chronic medical condition. Next slide. So if you see people experiencing warning signs, you should obtain medical care immediately. So then let's talk about diagnosing flu. You can do rapid influenza diagnostic tests, rapid molecular assays, and RT-PCRs. Positive rapid flu test is likely to indicate a flu virus infection during a flu outbreak. However, rapid tests vary in their ability to detect flu virus depending on the type of rapid test used and on the type of infectious disease society recommends the use of rapid influenza molecular assays over rapid influenza diagnostic tests. Next slide.
Renee, I love this little graphic.
Thank you.
From wild to mild. That's a good point.
Treatment and prevention. So the CDC recommends that all people use core prevention strategies. These are important steps you can take to protect yourself and others. Staying up to date with immunizations, practicing good hygiene, take steps for cleaner air. When you may have a respiratory virus, use precautions to prevent the spread, and seek healthcare promptly for testing and or treatment if you have risk factors for severe illness. Next slide. So those core prevention strategies: immunizations, hygiene, steps for cleaner air, treatment, stay home and prevent the spread. Additional strategies can include masking, social distancing, and testing. Next slide. How much do you know? You want to go ahead and hit enter. I think it's supposed to drop down. So, true or false, you can spread flu to others even before symptoms appear.
Go ahead, guys, use chat. Come off mute, say true, false. Great, great opportunity to be interactive.
Looks like we have some trues coming in.
It is true. You can spread flu to someone else before you know you are sick, as well as while you are sick. So true or false, flu illness can be more severe for certain people.
Looks like the consensus on this is also true.
And it is true, certain groups of people are at higher risk of developing serious flu complications. These groups of people include children younger than 5 years old, adults 65 years old or older, pregnant people, and people with certain chronic health conditions. True or false, and this is a fun one, a flu vaccine cannot give you the flu.
And again, true, you're making this real easy on them.
I know, flu vaccines, and it's true. You know, we hear a lot of misinformation on this, but flu vaccine cannot cause flu illness. Most flu shots are made using killed viruses. One flu vaccine does not use flu viruses at all. So that is interesting information. So true or false, flu illness severity and flu season severity can vary.
And the majority are true.
True, illness can vary from no symptoms at all to severe, depending in part factors such as age, underlying health status, and flu seasons can also vary widely in terms of their timing, severity, and impact on different age groups. True or false, antivirals can be used to treat flu illness.
Looks like true on this as well.
And it is true, influenza antiviral drugs can be used to treat flu illness. They can shorten the time you're sick, make your illness milder, and lessen serious flu complications that can result in hospitalization or death. They do work best when taken within 48 hours after symptoms start. And last one, some flu vaccines are preferentially recommended for people 65 years and older.
We're getting some true and just one comment, preferential, but any flu vaccine is better than none.
Yep,
Right.
and for the 2022-2023 flu season, there were 3 flu vaccines that were preferentially recommended for people 65 years and older. And I think, you know, I think that had to do with it just having more efficacy, maybe, for that older population, but it is true. No detractors. You're right. That's a good idea. I'll remember that for next time, Tiffany. Thank you.
Okay, with that, Renee, is there any questions that anyone has? Any questions in general? Anything you'd like to add? Feel free to come off mute. Do that now. We'd love to hear from you. Okay, we are approaching our time. Here is some references and resources that were used today. Here, if you would please just take a moment and scan that QR code. The CDC values feedback as much as we do. So I would encourage you to scan the code, fill out the little brief survey that's in there. There is an opportunity there for you to also drop any questions or reach out to us personally if you have something we didn't cover, a question you have outside of that. We're here to help and we'd love to do so. So please take a moment and scan the QR code there and complete the survey. With that, and on behalf of myself and the rest of the team, I'd like to say thank you for joining us today. I know it's at the half here. I was gonna see if Jess, maybe I know the CDC has a ton of resources that are available for posting this time of year, the respiratory time of year. There are some resources like Clean Hands Count, reminding people to wash their hands in relation to respiratory etiquette, covering your cough. The CDC has a ton of posters or infographics that you can print. Some speak to our providers, right, as a reminder to them. So you can remind your providers, your workers, your residents if you're in a long-term care setting, as well as to post at entries for visitors, making sure we get out the alcohol-based hand sanitizers, putting out Kleenexes, making sure trash receptacles are readily available, just all of those like cough and respiratory etiquette items. So
And Rebecca, there is a question in here. Are facilities making influenza vaccines mandatory? That is something I am not aware of at this time. I haven't received any information on that. Have you, Jess or Rebecca?
I think it very much depends on the organization, but I do from past experience, most flu seasons it has been. If there's any of you that have any input on that, what's happening at your organization, I'm sure it varies. It says Avera facilities require influenza vaccine for staff or an approved exemption.
looks like Tiffany says Sanford facilities are similar. And I think there is going to be some variability. I think if we reference to APIC, you know, they will remind us of the value of getting those vaccines, not just for yourself, but to protect the people in your immediate environment, your work environment, your community. So. All right, with that, does anyone have anything else? The QR code on your screen right now will take you to our website. You can check that out. Again, the products and different information we have are all available to you. You can also click out and reach us there if you have anything additional. Let's see, Tiffany says there are excellent publications by Paul Offit, if I'm saying that correct, that supports vaccination of flu for all staff. Great, thank you. Thank you for that, Tiffany. All right, I know we are at the end of our time and we're so very grateful that you joined us today. So on behalf of myself and the rest of the team, thank you for that. And we hope to see you next month. Enjoy the rest of your day.